And so effectively over time, you have more damage to your connective tissue and an inability to repair as that damage happens. And then obviously at the end of the day, you're gonna have aches and pains and you're gonna have problems with the musculoskeletal system. But this is not a mandatory condition of life. So senescent cells, you may have heard of this if you listen to any kind of wellness, anti-aging things. So senescent is just, most cells have a certain finite number of like divisions they can do, and then they stop dividing. So they can either stop dividing and just be a biologically active, helpful little cell hanging out, but it's not really producing anything in terms of growth, or they become what are called zombie cells, and they start spitting out this SASP, which is a senescence-associated secretory phenotype. And that goes to the pattern recognition receptors on the white blood cells and induces inflammation. So surgeons for years have known that there's these senescent cells in the cartilage because there have been these repositories where when people do the total knee, I showed you the picture of the surgery, and they resect off the damaged cartilage, you'll send it to these tissue banks and they just store it for future research. They've known for years that there are these senescent cells in the cartilage from total knee arthroplasty patients, but nobody knew what they were, so everybody just kind of like ignored them and didn't think much of them and continued to call it wear and tear and things like that. Well, now we're starting to understand what senescent cells do, what do the zombie cells do, and what does inflammation do to all of this. So, you know, this talk today might change next year. The body of science is constantly moving, thank God, and we're constantly learning more. But again, we should have known this 250 years ago, as I said. We just didn't have the tools to prove it. Now we're starting to get those tools. So aging and inflammation, again, normal cell, divide. Eventually it's gonna stop, it's gonna become a senescent cell, and it's either gonna be a good guy or a bad guy. We wanna always trigger it into the good guy. We've only really been knowing about this for 2 decades, and 2 decades is not a lot of time in the science world. I think it will be a lot of time soon, as now we have huge software tools and databases that let us learn things quicker. But chronic inflammation is the key to when you turn a cell to just a senescent cell to a zombie cell. So it's like, I don't know if anybody saw that show, I can't remember if it was HBO, where the cordyceps invaded people and turned them into bad zombies. So chronic inflammation is that signal that makes it a zombie cell. Another reason we want to avoid chronic inflammation and all of those signals. We want our cells that have stopped dividing to just be biologically active, but in a good way, not a bad way. So just to review, you've got your PAMPs, DAMPs, and SASP. Pathogen-associated molecular pattern, that's what your virus, your bacteria, your amoebas, your worms, that's what they're spitting off. Your damage-associated molecular patterns, that's what injury, micro tears, a little muscle overuse, stuff like that, that's what that's gonna spit off. And then your senescence-associated secretory pattern from your zombie cells. All of these are gonna go to your PRR, your pattern recognition receptor, and either tell the white cell to become inflammatory or anti-inflammatory, depending. These are all gonna be pro-inflammatory. Okay, so just to sum it up, what we're trying to do is reduce the signaling to the receptors on your white blood cells, the pattern recognition receptors, the toll-like receptors, things like that. We wanna reduce the pro-inflammatory signaling because we don't wanna upregulate the transcription factors, meaning the little proteins that go into the nucleus and tell what DNA to turn on and off. We don't want them to go make you more inflamed.